The St Pancras Transformation Programme is a huge change of all of our states, and by the end of this programme, which is probably around 2026, we will have virtually all of our services operating from new purpose-built buildings, which will be much better environments for our service users and staff, and hopefully will be community assets where people will feel these are important buildings and services in their communities.
We've reached a really exciting phase in the programme. Our builders are on site and the construction of the new hospital has begun. This building behind me that's being built is the first building of a number in the programme. This one will be ready in 2023.
We've brought a very experienced team to this project because it's quite a complicated build. We're building a huge hospital on a very small site.
We've faced a lot of challenges. The main challenge being trying to develop an environmentally sustainable building, which is therapeutic for our service users as well.
We've had mental health beds on the St Pancras site for very many years, and of course for some of us it is quite sad moving off the site where we've been so long, but we have to remember these buildings were never built to be mental health wards. They're not really fit for purpose.
Buildings in general have an impact on our sense of well-being, whether we have mental health problems or not. It's compounded if you're at a low point in your life.
I think it's very important that people are seen and helped in environments which are inspiring, which show that we actually value people, and that goes for both our service users and also our staff.
With regards to co-design, etc., and the involvement of people, I mean, I've been struck by the attention to detail. Also the taking of opinions from all sectors of the community, and it's a credit to everyone involved.
The need for outdoor space was talked about again and again. We have worked with the architects to create a clever vertical landscape, giving each ward a garden.
Instead of them being most of the time in a room where they don't have fresh air, they can be out, for example, if there is a garden.
It's going to have gyms, it's going to have cafes, it's going to have single rooms. It's going to be fantastic.
I think it would be also nice to have something off-ward for the patients.
A gym will be beneficial because it will get people off the ward, it will keep them fit, to burn a bit of time as well, so you're not sitting down all day watching TV.
I'm not a gym going person, however I'm glad that there's a sports hall because I love skipping. I skip in the mornings. I do my own yoga moves, Pilates.
Human beings are social animals. Without social inclusion, our self-esteem lowers, our autonomy lowers, our motivation lowers, so it actually all goes hand in hand.
The cafe, which is open to all, will support social inclusion by helping service users to feel part of the community while they're in hospital. It will also help to erase the division between the mental health facility and the local area.
So in the design of the new building, we have really wanted the building to be a community asset, which means we want the community to feel that this building belongs to them.
And our new gym, we want to be open to actually wider use, whether it be the staff at the Whittington or the locals, to be able to use it when we're not using it for our patients.
Sustainability is very high on the agenda for us. This building has been designed to a BREEAM Excellence standard, and that means we'll incorporate very high levels of sustainability in terms of recyclables, having solar panels. We're also going a step further where we're looking at introducing bed boxes to bring the environment into play as well.
So we're going to have two hospitals, two buildings, the Highgate East and the Highgate West, and of course the Highgate West is an older building, but there will be some refurbishment in that building, and of course the Highgate East will be the brand new building. But they're just across the road from each other, so they will operate as one campus, which means that people from either of the buildings can use facilities in the other building.
I think we're better when we're joined up. There's a big distance in space between us, and also that can cause a distance in relationships. So I think when we're closer together, we'll work closer together to give a better impact on the recovery of our service users.
I think there's a benefit to having two different sites. It's very difficult if you've got people on a rehabilitated pathway, almost not separated from people that are acutely unwell. Because when you're acutely unwell, your ability to engage is less open. When you're on that recovery process, you might be learning new ways, you might be trying to break old habits, you might be trying to develop your independence in the community rather than your dependence within the hospital. So I think having those two sites separately, it's slightly more normalising, because when they're both together, they can influence each other.
So the two trusts will be able to work together in a much more collaborative way. It's a real opportunity to have staff on the same site meeting personalised care for patients who use our services, and also the opportunity to sort of improve physical health for our mental health patients, as well as improve the mental health of people who are physically unwell.
It'll be much closer for people from the Whittington to help with physical health problems. It's easier for patients to be moved between the two hospitals if they need to be seen in clinics. I think also the learning will be a fantastic opportunity for staff on the Whittington side to join in the learning that we are doing, and of course for us to be able to join in some of the training that they're having.
The new hospital is absolutely a transformation in the services that CNI will be able to provide for its users. I mean, it's fit for purpose and fit for the 21st century.
So we are so used to mental health buildings being at the back end of nowhere in an old building that's not really purpose-built. This new hospital is a purpose-built building that is big, it's beautiful, and it's got the right space and facilities for people with mental health problems. This is saying mental health services are important, and we value our service users and our staff.